My name is Don Klein. I am a father of 3 children. My oldest one is 52, my youngest is 34. I have 6 grandchildren and was with my wife actually 42 years before she passed away, 1 year before the day that I got my stem cell transplant. What happened was I started feeling very fatigued. My feet were always swelling up and in pain all the time. I was having a hard time even making a fist. And I went to the doctor and they thought I might have rheumatoid arthritis. They did some tests and MRI was one of them, and they found some lymph nodes that were kind of enlarged in my abdomen. So that's how I kind of met Rocky Mountain Cancer Center.
As I was taking care of him, his blood counts rapidly became abnormal. His counts were up around 200,000, and a normal white count is 10,000 or less. We work with Colorado Blood Cancer Institute on patients who have hematologic cancers, and that's when I got in touch with Luke Mountjoy.
I remember Dr. Monticelli calling and say, I got this guy whose white blood cell count is really high, they look really abnormal, and I'm worried this is chronic neutrophilic leukemia.
When the disease starts progressing rapidly, as Don's did, that's an emergency. You got to do something within a week.
He transferred up to us and we started him urgently on chemotherapy, and his disease proved to be stubborn.
He said, I don't have any really good news for you. And I said, okay, well, what you got? And he says, well, you have a very rare form of leukemia. There's really no medical treatment for it. He said, and that is like 15, 20 months. And I looked at him and I said, you mean 15, 20 months to live? And he said, yeah, unfortunately. And I said, okay, well, what's the other option then you talked about? And he says, well, that's a stem cell transplant. And that's where we have to find a donor. And he goes, which is going to be a little tricky because we're in the middle of COVID. Getting them here to donate their stem cells might be a challenge. And I said, it'll work out.
He just had that attitude and still has that attitude, and it's infectious. And we started him urgently on chemotherapy. He was in the hospital for a long time.
The hardest part of any of these treatments is the chemo, because that just eats your body apart.
But it worked. We were able to drive the disease down into remission. No lollygagging, get him right to that transplant as soon as possible.
He says, I've got 3 donors. They're all domestic. He says, they're all young guys and they're all 100% matches to your body. And I said, oh, I go, is that good? And he said, Don, you don't realize how good that is. He goes, a lot of times if we get an 80 to 85% match, we're ecstatic about it. It was the 3rd day after my stem cell transplant at 3:07 a.m. I'll never forget the time because I looked at the clock when I woke up and I felt something on my heart, and I grabbed a pad of paper and a pen and I started writing. I wrote down 4 things. First one being, I was going to be okay, I'm going to survive this. The second one was that when I'm well enough, I need to volunteer at a local hospital. Third was I was supposed to actually do some volunteer work to help other cancer patients, which I've been about a year now a volunteer for the Leukemia and Lymphoma Society, LLS. And the last thing, which was probably the most scary part of it all, was I was supposed to write a book about my journey, but about how I got through my journey and all the help that I had within it. And if it sells, I'm going to donate all the funds to cancer research. I've never even heard of CBCI before, and then here they're one of the premier organizations that do this blood cancer work. I had looked up Dr. Mountjoy's story online. I was shocked to find out that he had gone through this.
Don's wife passed away from medical issues, and my father was diagnosed with pancreas cancer when I was 13, and he died. And then a year later, I got acute leukemia, just like Don's wife passed away, and then he gets a really nasty leukemia. And I'm alive from what previous docs did for me. And to be able to do that for Don, it's about as good as it gets.
I think that, God has a way of putting the right people in place in our life.
He's a couple of years out now from transplant, and it looks really good. He's doing amazing, and I'm very optimistic he's cured.
To me, this is a pure blessing to be able to tell my story and see if I can be a light to other people.